Welcome back to the Arizona Daily Mix. Sitting with my favorite doctor, Dr. Rizik here, as we get ready for another heart procedure. And we're catching people up on, of course, heart disease, heart situations. And we got calls in from people, viewers, that want to talk about women and heart disease.
Great subject.
It is.
Great subject.
And you can correct me on this, and that is I watched a program that talked about women and heart disease and heart attacks, and that it wasn't until about 1998 that they started to separate the symptoms, the causes and everything, because the doctors and nurses were using books up until 1998 that were just putting everybody into one kind of like basket. So if you didn't have the symptoms like a man had, you weren't having a heart attack.
Absolutely true. So let's divide this up over the next couple sessions. Let's talk first about heart attack in women. You're 100% right when you say that it's only been in the last 2 decades that we've really begun as a profession to understand differences between men and women with respect to heart attacks. For instance, the symptoms. The symptoms can be very different. When we talk about that chest pressure or chest discomfort, that's really more typical of men having a heart attack, not women. Women can have very different symptoms. They can have shortness of breath. They can have dizziness. Women traditionally may not have the chest pressure. They may have neck pain, pain radiating down the arms. It can be very different. And so the cardiovascular practitioner has to be very, very careful and listen to the symptoms with which women present.
Yeah. Let me ask you this. What age will you start seeing those symptoms? Because I know some people think, well, you know, as they get older. Can it be when they're a little bit younger?
Absolutely it can. And I think we have to pay attention to the risk factors that women have at young ages. For instance, a pregnant woman who has preeclampsia or diabetes, what we call gestational diabetes during pregnancy, that's a risk factor. So it's not too early to be modifying risk factors in women. When you talk about age differences, we spoke before that men tend to have heart attacks at a younger age than women on average. The average age of a man in this country having a heart attack is 60 years of age. Women, about 70 years of age on average. And if a man is a smoker, maybe even 10 years earlier than that. So the age distribution between men and women on average is different. But I have seen 45, 40-year-old women come in with heart attacks. The symptoms not exactly the same as what we see in males, but you have to be very vigilant and you have to listen to your patient and the symptoms with which they present.
Yeah. Also, I think, as we were talking before we came on, one of the problems I think that you detect heart attacks in men sooner is because we're babies. As soon as we get indigestion, we're running to the hospital. We're like, I got to see a doctor. I think something happening. But women, they might have that symptom of a little dizziness. So they're like, oh no, I just been in the kitchen too long. I'm going to take a seat for a moment. Is that why we're not seeing it? Because they're much stronger. They're kind of like ignoring those problems.
2 facts. One fact is women present later. Women present later in the throes of a heart attack than do men. And oftentimes, when women go to the emergency room, their symptoms are either overlooked or some of the diagnostic tests are not as predictive in women as in their male counterparts. So there's a number of different reasons that heart disease in women, especially heart attack, goes unnoticed or undiagnosed. They present later, and oftentimes their symptoms are even glossed over.
Yeah. Okay, I know we're wrapping up here in a minute. Let's talk very quickly about some symptoms, just as those who are watching at home right now, just a few that you could say, if these are some of the things you're having, please see your doctor.
Men, a little bit more traditional: chest pressure, chest pain, heaviness, tightness in the chest. Women can have jaw pain. They can have neck pain. They can have arm pain, one side or both sides. One interesting symptom is dizziness and shortness of breath, maybe even back and neck pain. When patients present with these symptoms, you have to be open-minded enough and vigilant enough to look for potential causes. And in women, it's not always obvious because we've only begun to recognize this over the past couple decades. One other issue that I think is very important to recognize, you know, when we treat a man and a woman for heart attacks, the prognosis is very different. Men generally do better. But I think that's because women present later and oftentimes the symptoms go unrecognized. Yeah. So men have a better prognosis with heart attacks than women, and we need to change that in our profession.
Yeah, and you're also wanting people to know that, I know they talk about, well, go see a woman doctor, go see a man doctor, go see this. You're saying, go see a doctor.
I think rather than just saying a woman with heart disease needs to go to someone who specializes in women's heart disease, I think, Brad, we got to up our game in medical school education. We don't send a woman with diabetes to a women's diabetic specialist. I think we have to up our game in terms of education and make sure that men and women coming out of medical school understand these differences between men and women in heart disease, rather than just say, okay, you have to go find yourself a doctor who specializes in women's heart disease. That's my opinion.
There it is. What do you want to talk about next week?
I think we talk about the outpatient workup, what happens in the clinic when we see patients, not necessarily in the throes of a heart attack, but how we begin to make the diagnosis of heart disease in an outpatient clinic.
I like it. And don't forget, you can go to aztv.com/procedure to see our last procedure and to see what's coming up next for our next procedure. A lot of procedures going on. So, Doctor, thanks for joining us today.
Good to see you.